Hello and welcome everybody to today's lunchtime webinar brought to you by Capital Health Network in collaboration with the Australian Digital Health Agency. Firstly, I would like to acknowledge the traditional custodians of the land we are meeting on, the Ngunnawal people. I acknowledge and respect their enduring culture and their contribution they make to the life of this city and this region, and I pay my respects to their elders past, present and emerging. I also acknowledge and welcome other Aboriginal and Torres Strait Islander people who may be attending today's event. Their land was and has never been ceded. Today's webinar focuses on the Provider Connect Australia platform. I'm Michaela DeLiba, a physiotherapist and Quality Improvement Project Officer here at Capital Health Network, and I'm here today to present on PCA. Before I get started, we'll just do a little bit of housekeeping. So all participants should be muted in the Zoom already. Please address any questions you have in the Q&A section, so not in the chat function, but the Q&A, and we'll have time at the end of the presentation to go through any questions. You can enter those at any time throughout the presentation and we'll address them all at the end. The presentation itself will be uploaded to the Capital Health Network's YouTube page. So please feel free to share this with your networks, anyone you know who couldn't join at lunchtime today. Regarding CPD, please make sure you fill in the post-evaluation survey. Once that's completed, we'll be able to email you a certificate of attendance, and then you're able to self-report 0.5 hours of educational activities to your CPD home for attending today. I'd also like to mention before we start the Health Pathways website, which has up-to-date information about digital health in primary care under the digital health page. To access Health Pathways, the login is together and the password is FORHEALTH, all one word. Health Pathways is a reliable source of up-to-date clinical and referral information that is localized to the current area. In terms of digital health, the page features information on electronic prescribing, My Health Record, secure messaging, and telehealth, but stay tuned for the addition of a Provider Connect Australia page there as well. As always, your feedback is invaluable to keep these pages up to date and reflective of our local health environment. So you'll find a feedback tab at the bottom of each Health Pathways page, and we encourage people to use that to provide feedback. Okay, so we might jump into things now. Okay, so what is Provider Connect Australia? Provider Connect Australia, or PCA, is an initiative by the Australian Digital Health Agency to assist healthcare provider organisations to update their business information in a single source. This reduces time spent on updates, ensures up-to-date information about healthcare services is available, and reduces transcription errors. So who is a healthcare provider? Healthcare providers include general practices, allied health practices, and private medical specialists. And if we then think about our business partners, who would we consider a business partner? A business partner includes health service directories, online booking systems, funders, primary health networks, diagnostic services, communication services, and public and private hospitals. So what can PCA do for you? PCA can save practices time by reducing data entry duplication when filling in multiple update forms. It reduces the risk of transcription errors, streamlines notifications of changes to business partners, and helps to ensure that information is complete and up to date so that partners have accurate details for your health service. An important consideration as the ACT increases the use of smart forms across our health services. The Australian Digital Health Agency has step-by-step instructions and videos on their webpage to help organisations through the registration process. But broadly, the registration process involves ensuring that you have a Proter account and that you're able to log into the Proter account, making the agency a contracted provider in HPOS, gathering your organisation's details, and then signing the participation agreement with evidence of authority, which we'll discuss a little bit more in a few slides. So how does one access PCA? PCA can be accessed through your Proter account under the Provider Connect Australia tile, which you can see highlighted in yellow. Once you log into Provider Connect for the first time, the registration setup wizard will assist you in moving through the registration process. However, if you are requiring further assistance, you can always consult the Australian Digital Health Agency's PCA website, which has some pretty clear instructions, or you can also reach out to us through our primary care team for assistance. The ADHA's website also contains a pre-registration checklist, which I'd highly recommend, that has advice on collecting the necessary documents so that you're prepared for registration at the time that you go through. When registering, you'll also require access to HPOS, so Health Professional Online Services, to nominate the Australian Digital Health Agency as a contracted service provider. You'll need to do this in order to publish healthcare identifiers to your business partners. And for this process, you must be an organisation maintenance officer for your healthcare service, which also requires you to have Proter access. There are, however, some more detailed steps to assist you through this process, which are available on the ADHA website. Once you've been able to log into PCA and nominate the agency in HPOS, you will then require some organisational details to be able to complete the registration process. And these details include the organisation's ABN, your HPIO number, which is available in HPOS if you find the organisation snapshot under the summary tab. And then you'll need the up-to-date contact details for your service. So that includes phone and fax numbers, a current web address, the organisation email address, and if applicable, alternate email address for legal notices. The final component of the registration process includes signing with evidence of authority. So as part of registering for PCA, someone in the organisation will need to sign the participation agreement to agree to the terms and conditions of use. And this needs to be determined in advance along with suitable witnesses if required. You'll need to decide if you or someone else will sign the participation agreement between the agency and your organisation as a delegated authority or as an authorised officer. And there is some very helpful information and a table summary of what that will involve on the ADHA's website, which will be different depending on your organisation. So once organisations are registered for PCA, organisations can then import healthcare identifier information. They can add multiple service location. You can specify the types of services that are provided, add individual provider details, and then publish updated details to business partners. So, a little bit of detail on what each of those things include. So, service locations details the physical address of each health service. Service information includes information about the types of services provided, languages spoken, service provision conditions and eligibilities, appointment and referral details, and operating hours. And finally, under practitioners, a list of practitioners and their languages spoken can be detailed. So now that we've discussed a little bit about what PCA is, I'd like to remind practices of what PCA is not, based on some feedback we've had from a few different practices. So, although a very similar registration process was followed previously for the Vaccine Clinic Finder Connect during the COVID-19 pandemic, which you may or may not be familiar with, VCF was previously the national portal for COVID-19 vaccinations, but has since been retired in June of 2023. But VCF Connect and Provider Connect Australia are separate platforms, and practices are required to re-register even if they were previously registered for VCF Connect. VCF Connect has since been replaced with Health Direct Australia's Service Finder function, which currently acts as the national platform for COVID-19 vaccine services, along with several other functions. Health Direct is an established business partner in PCA, so in registering for PCA and updating your details as they change, it will ensure that your vaccine information is up to date and correct. But also, Health Direct currently run a service finder for general practice services, allied health services. So this means that your up-to-date information will be available for consumers to search. Okay, so how do PCA, Health Direct, AHPRA, and the Healthcare Identifier services all fit together? PCA itself provides a single place to update healthcare service information. This information is then automatically updated in Health Direct, where consumers and healthcare providers can search for available services. Individual providers themselves can be found through AHPRA, and AHPRA is the primary source for providing healthcare identifier numbers. Healthcare identifiers themselves are unique numbers that identify healthcare providers. And each of these entities work together to keep information about both individual practitioners and healthcare organizations up to date and available for use or to publish to consumers or other business partners. So what I'd now like to do is open the floor up to any questions. So please feel free if you have any questions to jump on to the Q&A and ask away. While I wait for any questions to come up in the chat, which I strongly encourage if you do have any, I'd just like to say that we're encouraging all practices, including allied health, not just general practices, to reach out to our primary care team via phone or email if you do have any questions regarding PCA. So we're more than happy to call, email, or visit practices to assist them with their digital health needs. So don't be shy and reach out to us if you are needing some help with how to register or have questions about why you should register anyway. I'm going to give one last minute for any last minute questions to pop up into the box. But if not, I'd just like to remind everyone to complete the post-event survey so that you get emailed your certificate of attendance and you can claim your CPD hours. And if you have any questions that pop up that you didn't think of whilst today's webinar was running, please feel free to email us at primarycare@chnact.org.au. Okie dokie, since there are no last minute questions, we might wrap up for today. But once you complete your post-event survey, you'll also be sent a recording of today's session. So if there's anything additional you wish to go over, you can always look back on the recording. Thanks everybody for attending today.